Joined today by Dr. Carla O'Day, leads the emergency department at St. Vincent Charity Medical Center. Has many years experience in medicine, many years experience in emergency room work, and she has dealt with a number of COVID patients over the last few months. So I'll talk just for a few minutes, then I'll turn it over to the doctor, Dr. O'Day, and she'll take questions and I'll take questions. So thank you all very much. Every county in Northeast Ohio is now literally on fire from this virus. This is a chart which you won't be able to see, but it's a chart of each county in our region, Northeast Ohio. Every single county is at a very, very high rate of COVID. The CDC measures it by how many new cases in the last 2 weeks per 100,000. And if you look through here, every single county is at least 3 times the CDC's high incidence level, at least 3 times higher than that. Some of the counties, most of the counties are 4 and 5 times, and we have, very sadly, Lake County that is at 1,000, which is 10 times the positivity level for high incidence. So in Lake County, for example, in the last 2 weeks, 1 out of every 100 person has been diagnosed with COVID. So it's just a phenomenal raging fire going through the state. Now there is good news. The good news is that we have a vaccine coming. We have vaccines coming. And the news that we heard yesterday, the news we heard last week indicates that these vaccines are about 95% effective, which I'm told by doctors is a really phenomenal high level. So that is great news. We hope, Trump administration tells us that we will start getting these in Ohio in December. The first batch will be, we're told, 30,000, and we will have batches come from then going forward. So we will first try to put a shell around or a wall around to protect our nursing home patients. And we'll do that by giving the vaccine to those workers who work in nursing homes. At the same time, we're going to be reaching out to our healthcare workers to get them vaccinated as well. This will take a while. This will take a number of months to get done. But for the first time, we now have great confidence that this vaccine is here. It's going to be used, and it's going to take us out of this great tragedy. But we have a few months to go. And so we all together have to build a bridge. We're in the process now of building a bridge to get us to that time in the future. And what we do in the next several weeks as Ohioans will determine if we can really build this bridge and if we can slow this spread of this virus down. So we have taken some actions in the last week that should help, but the most important thing is what each individual Ohioan does. Last week, we expanded our mask order to make sure that in retail establishments, if you walk in and you're shopping, you go to the grocery store, wherever you go to, you should have assurance that everyone in that place is wearing a mask. Conversely, if you're at the checkout, if you're stocking shelves, if you're doing work that is frontline work that you need to be doing, and you're medically compromised, you have every right to expect that everybody who walks into that store has one of these. So we now have inspectors who are going out. They started yesterday morning. We're already seeing mask compliance go up in our rural areas where it has been low. So we're confident that this is going to help a great deal in our retail establishments. Second, yesterday I announced a curfew. The curfew will start tomorrow night at 10 o'clock. It will run from 10 o'clock until 5 a.m. And the whole purpose is to reduce the number of contacts that people have. You remember in the spring, we were able to dramatically cut down contacts, and people stayed home more. They made decisions, well, instead of going to the grocery store a couple times this week and running out to get milk or do that, I'm going to pull back, I'm going to make a list, I'm going to do it once. And it's just things like that. So we're asking people to slow down. We're in a slowdown, certainly for the next 21 days. If we slow down, if each one of us, every single day, cuts down on the number of contacts that we have with other people, and if we wear a mask, we can knock this down very, very well. Let me now introduce Dr. Carla O'Day.